in order to take advantage of some of these trends. So first, hopefully you can see the screen now. As a lot of you know, with the Affordable Care Act, there's been a lot of changes to the system. The most considerable one that we'll talk about today is what CMS is doing on the payment side. So I'm sure a lot of people have heard about quality-based contracts, risk-bearing contracts, ACOs, and the like. Well, what CMS has come out publicly and said is that 90% of their payments are going to be linked to quality measures in 2018. And this isn't meant to be scary. I think this is really an opportunity for all of us to really align what's best in the best interest of the patient. And that is to make sure that the payments, all of our services, and all of our thinking are really driven towards quality of care and healthy outcomes. You know, further, Medicare has come down and said that 50% of the payments will be linked to risk by 2018. So again, this is to say that they're going to reward us for doing everything we can to making sure that patient is healthy in the first visit, and really to try to avoid, and a lot of this is more on the hospital side, readmittance and patients coming back into the hospital within 30 days for the same ailments. So again, a lot of you guys have seen this. I just paint this as an overview to say, you know, the population is aging, payment systems are changing, and so what we're seeing in the market as a reaction to those two things is a lot of consolidation. And so you've seen this with hospitals acquiring primary care. It's happening all across the U.S. healthcare landscape. In fact, the Wall Street Journal last year said that 2015 was on pace to notch the most U.S. hospital deals since 1999. So that's 16 years into the past. And what we're seeing, and again, the Wall Street Journal said this, not me, is that a lot of smaller players, a lot of the independents, a lot of the rural practices are deciding that they can't go at it alone. Well, what we're seeing is that that is in fact potentially not true, and we've got a couple things that we want to share with you to think about how you can retool your practice to compete in the new world without having to be part of this consolidation. So we're going to talk a little bit more specifically about eye care, both ophthalmology and optometry. We think there's a really good opportunity for both of those professions to take a leadership role in the sea change, and for both of them to do more medical eye care. And so what we've heard pretty loud and clear from a lot of our providers that we've talked to, a lot of the doctors, is they want to maintain their independence. However, they're all concerned that without consolidating, they won't have the capacity to participate with these new contracts, and they're going to lose out on patients. And so there's a lot of fear of the unknown out there. And again, speaking specifically about optometry for a minute, you know, there's not a general history of them contracting with medical health plans. And so their fear is that they're going to get either pigeonholed into a vision provider, which obviously they're not, or they're going to get left behind if they can't reorganize. Now, what's happening in the consolidation space is that not all care delivery is represented. There's a lot of specialty groups that are not part of the acquisitions. We touched on ophthalmology and optometry, but also dermatology, mental health, kidney dialysis. A lot of these spaces, you know, ortho, are deciding that they can go at it alone, and they don't want to merge and be part of the hospital. The other thing that I think is really fascinating is that, you know, when a practice decides to sell and becomes part of a system, there's a 30 or 40% inefficiency that is realized because of the overhead associated with those. And so it actually works against what a lot of the folks in DC and a lot of the folks that I talk to on the health plan side are trying to do, which is deliver more efficient care to deliver better outcomes. Now, most people don't realize that eye care is a big spend item. A lot of people think that it's down the list, and cardiovascular and oncology and those things tend to get more of the lion's share of the press, which they do, but eye care is 10% of all the Medicare spending. So it's a big number. They're big dollars. Plans are taking notice. I mean, each year over 100 million eye exams are performed. And so now we're looking at how do we take those patient-doctor interactions and do more with them and provide more medical services at that point of care, and then provide the systems back that data. So what we're out talking to folks about is perhaps another model, which is to create integrated networks to improve the patient experience, to lower costs and improve quality, but allowing you to stay independent and allowing you to continue to grow in the eyes of the whole U.S. healthcare ecosystem as a medical provider offering a lot of medical service above and beyond just the traditional eye care or vision screening services that a lot of our doctors share today. And so what does that look like? When you think about what does a network of optometry and ophthalmology in a local market look like, typically it starts with a health plan or a health system where they've got a large population that they need to contract for in their market. And so when we put these integrated networks together, you need to manage the network. You need to have the administrative pieces together, which is the health system contracts, network management, all the financial and the back office stuff. You need to have call centers. Obviously, technology is a big piece of this. So how do you connect multiple practices together that may have different EMRs, may have different practice management tools? And then how do you, as a network, manage that entire population of patients? And then how do you integrate seamlessly within the health system and the health plan and make sure that this data is ubiquitous and flowing across? So this slide is a lot, we know, and it's not meant to scare you, but it's meant to kind of give you a roadmap of what you would consider doing in your market to pull all this together. So while it is complicated, we feel like there's a couple really elegant solutions to make this very simple. So I'll talk to you a little bit about kind of what we're doing here at OcuHub, what we're doing with some of our provider partnerships in the market, some of the health plan partnerships that we brought together, just to give you a sense of a different way to think about the changing marketplace. And then at the end, we'll open up for question and answers, and happy to follow up with anybody to go into a deeper conversation. So for those of you who don't know us, again, this is kind of our launch of our 2.0 platform. We're going to have monthly seminars on a variety of topics, but just to ground you with who we are as a business, OcuHub at its core is a health information platform and services company, and we help payers, health plans, health systems, and doctors integrate eye care services into mainstream healthcare to improve outcomes and reduce costs. So it's really to drive the triple aim for all of the parties involved. And so what does that mean? That means we go out, we work with provider leaders in the market, health plans, to build integrated eye care networks and connect those networks with health plan patients and large populations of hospital systems to both grow our providers' practice, to help the plans make sure all their gaps of care are met or filled and their standards of care are met, to reduce the overall cost of care by leveraging the large reach that optometry professionals have in the market, the incremental services they can provide while the patient is within their practice, and then provide the data back to those entities so that they can work with CMS to get extra reimbursements. So again, I know it's a lot. This is really meant to be a high-level overview, but really integration is made easy. We'll take all of the legwork off of your shoulders. We'll put the networks together. We'll help with the credentialing. We'll put the technology in place. We'll build the health plan relationships. But it's not one size fits all. And so if there's certain aspects of building a network that your practice, your doctor leadership want to do, we're absolutely open to providing an a la carte or a flexible model to go into a market, conduct a needs assessment, look at where your capabilities are, and come back with a plan on how we can collectively get new contracts, be part of these new narrow networks, and thrive in the new marketplace rather than continuing to feel uncertain about what the future holds. Now, often I get asked the question, well, what about this CMR? What about this practice management system? Or do I need to change? Because it's really complicated. And the simple answer is no. OcuHub is integrated with all of the EHRs in our space, with all the practice management systems in our space. And so the good thing is you don't have to install new software. You don't have to buy new hardware. You don't have to replace anything that you're using today. Our platform sits between your practice and all the other practices in the network, between your practice and the health system, and between the network and the health plan, and we make that all seamlessly through a cloud-based solution, and I'll show you a couple of examples of this. So it makes it really simple to get going. Hopefully you've kind of seen, and based on your experience in the market, kind of why joining a network has its benefits. Obviously the network has a shared goal for practice growth, patient access, but really everything we do is with the patient in the middle to drive to better healthcare outcomes. So on the ophthalmology side, right, they can maintain their independence. They're getting more surgical cases. They support their referring optometrists in the market, and they gain those covered lives from the payers. And then on the Medicare side, we obviously see a lot of comorbidities as the population ages. Optometry is the same thing, right? It's maintaining their independence. We're really looking to optometry to be that primary medical eye care provider. So while there's a great capability in vision exams and fitting glasses and contacts, really allowing them to not only do a comprehensive dilated eye exam, but doing A1C collection, doing hypertensive screenings, doing BMI screenings, all of these things that the health system need to fill for gaps in care. We are really arming our optometrists with those services, which are obviously incremental billing opportunities, services we can provide, but they're really filling a big gap that's in the market. And then, of course, there's a reduction in admin time for moving paper-based referrals around. Same thing on the staff side. The system is really easy. It automates a lot of manual processes today, things that are kept in Excel, co-management fees that are kept in egg crates under the table, proving practice efficiencies, and obviously what we've seen is a really strong increase in patient satisfaction. So kind of drilling down a little bit, one of the big things that you'll hear a lot about is care coordination. And the problem is a lot can go wrong in referral processes today. So a patient is referred to a specialist, whether it's from a PCP or an optometrist, specifically talking about eye care now. Patients a lot of time received, handwritten notes. Here's a provider's information column. A lot of patients don't follow up in timely manners. They lose the information, and then really that patient is lost from us as a system, or the doctor that they refer to is at an inconvenient location, or they're not in network. And so there's a whole lot of challenges with the current referral system where the patients are frustrated, the coordination is broken, and so patients are lost. And so some of the solution, and I won't read this slide, and Melissa may have mentioned this at the beginning, but we'll share this deck with you all after the call. But this is a way to keep patients in network, allow you to do what you do best, refer the patient to a specialist where you need it, track that patient through that process, and make sure that patient comes back for follow-up care. And so what we're seeing is not only the ability to create transparency amongst that process, we're seeing a large patient adherence to the process, and we create a lot of analytics through this. So both everybody wins. The patient wins because they're getting the appropriate care in a timely manner. You're able to confirm that the patient's getting the care that they need at the right point of the system. So hopefully I'm not going too fast. I do want to leave enough time for question and answers at the end. But here's a snapshot of what the system looks like. Again, it's a cloud-based system, so you simply log in through any browser. Everything is HIPAA secured. We are a Meaningful Use 2 certified provider to allow these communications and clinical data to move from your practice to others. You can see on the dashboard here, it's as if I was logged in. You have a spot on the top left for your practice's branding, so as people log into your system, they understand it's your practice. You can share direct messages to other practices. You can schedule patients directly into the network's practices. You don't have to call. You don't have to ask the patient to do that. We have some care coordination tools for populations, reports, file updates, and announcements. I won't go through all the details. Again, we're happy to go into detail later. But again, it's a very simple interface. And so you can see here, I've got a patient. Maybe they have early signs of cataracts. I need to schedule them for cataract evaluation. I click the cataract button. The system then walks me through step by step what clinical data, what patient demographics do I need to provide the receiving practice so that the patient is seen and makes it seamless for everybody. Again, as I mentioned, we are MU2 certified and HIPAA compliant as well. The second set of tools that we have is really to help manage these populations of patients. You can see here a picture of what our care coordinator would see. Depending on who you are, when you log in, you'll get access to these different tools. So not everybody in a practice needs to have the population tools, but I want to share with you a little bit of what they look like. So here is an example. Well, we worked with the network, and they were able to bring in 126,000 lives into the network. And so we developed tools to manage 126,000 patients as they go through the scheduling process, They've made appointments. Did they go to the appointment? Did they no-show? Did they reschedule? Once we've confirmed that the appointment was handled, did we get the clinical notes back? Did we get the proper reporting back that we need to provide to our payers? And then move them into a final stage where they sit until they're required to follow up for care either next year or 6 months or 24 months, depending on the patient's specific case. So again, you can see here, really simple design, really easy look and feel to navigate. But as you think about going from managing one patient at the phone or one referral at a time to having to manage 100,000 lives, the tool set needs to change, and that's what we provide to the market. Here's a drill down of that within that same tool, and so you can look and see how many times have I contacted a patient, how many days has the patient been pending in my queue. You probably can't see it very well because of the screenshot, but you can see the patient's information, contact information below. Each one of those can be drilled into to put notes in there, to put patient preferences, anything you really want to help you manage that patient experience and that interaction. So the last kind of screenshots I'll share with you, again, these can be custom built. These are what we're doing today in the market with several of our partners. We do a lot on the reporting side, so you can see within your total network how many patients were referred in, how many were seen, what types of patients were they demographically, what diseases did we identify, what procedures were given, what referral patterns did we see. And our belief is that when you're managing large populations of patients, the best way to think about it is to have our optometry partners conduct the first line of examinations, and then where we find diseases or follow-up care need to refer those to specialists, and the care coordinator helps manage that flow. So everybody wins, right? Optometrists are seeing more primary medical eye care and referring to ophthalmology where necessary. Ophthalmologist partners are seeing more specialty and subspecialty care, and the systems are seeing a cost benefit because what we can do in the community is a lot of times more efficient than we can do in the surgical centers, as well as we can do a lot more than just eye care, as I mentioned earlier. A1C, we do a lot with diabetes, we do a lot with a lot of other diseases, hypertension, outside of traditional eye care that obviously a lot of you guys went to school for and studied really hard to be able to do, and we're really just trying to help that become elevated in everybody's mind. So 2 more slides. Thanks for bearing with me so far. Really simple to get going. You just let us know you're interested. We're happy to schedule a demo, complete a quick onboarding process to see what makes sense in your local market. We'll get accounts set up. We'll build a network. We'll bring the health plan or health systems to the table, schedule some training, and then literally you're off and running. This whole thing can be set up in as little as 3 or 4 weeks. If everybody's around the table and aligned, obviously pulling the parties together can sometimes take up to 90 days. But it's a very simple process, and it's one that we're willing to do all the work because we see the big benefit for the U.S. healthcare system overall. And just want you to know that it's very, very simple and doesn't have to be complicated. So kind of in closing, we believe that for eye care providers who want to own their own path to value-based payment rather than wait as well as stay independent, that there's another solution other than selling your practice, and that's to create virtual networks so that you act like an integrated system, but you don't have to actually sell your practice, change your IT infrastructure, and we really help pull the network and the payers systems together to make this all happen seamlessly. So I just want to thank you for your time and for your listening. Again, we'll circulate the deck, but if anybody's got any questions, we're happy to turn it over, and Melissa will help moderate that session.
Hello, everyone. Please just raise your hand if you have a question, and I will unmute you. And certainly you'll notice on this closing slide that Stephen's email address is on there, and you have my email address as well. So should you have any additional questions or be interested in a further webinar or demonstration, please just let us know. At this point, I don't see any questions. So we will let you guys go early this evening and have your rest of your day back. Thank you for joining us.
Thank you all very much.